Assalamu alaikum viewers and welcome back to my channel Biodinverse Hub. Today in the playlist of oral and maxillofacial surgery, we will be discussing the same prevention and management of extraction complication. And in our third video, we will be studying about the management of mandibular root or tooth displacement. So first of all, most probable chances is that the tooth or the root displacement can occur into the submandibular space. And here the most commonly tooth involved is the mandibular third molar. Again, we need to understand the causes. So causes or reasons for displacement includes the lingual cortical bone becomes thinner as we go posteriorly. So in that regard, if you have not keep that point in a consideration, it could lead to a mistake and the root or the tooth could be displaced into the submandibular space. Then, in mandibular third molar, the dehiscence overlying the lingual bone, it may actually be sitting in the submandibular space preoperatively. And if you have not made a careful assessment and examination, so it is very obvious that the displacement of the root or the tooth could occur into the submandibular space. Then apical pressure from the elevator, you were using the straight elevators and the apical pressure exerted was so excessive that it pushed the root or the tooth fragment into the submandibular space. So now if the root or the tooth displacement has occurred into the submandibular space, we have two cases. In the first case, if the root segment it is small and uninfected preoperatively, you can leave it as it is. But again, as there is the risk of lingual nerve injury in your attempt to retrieve it back. So therefore, if that is the case, that root segment was very small and uninfected preoperatively, you can leave it as it is. Now, second is the case if the root segment that was displaced was very large and it was also infected preoperatively. In that case, index finger of the left hand should be inserted into the lingual aspect of the floor of the mouth, then applies the pressure against the lingual aspect to force the root back into the socket. If it works well, then retrieve it back to the root tip picks. But if it doesn't work well, and in that regard you need to refer the patient to the oral and maxillofacial surgeon, or the lingual soft tissue flap is reflected and dissect the mucoperiosteum until the root is contacted, and after that retrieve it and then close the wound and suture the flap. So this was all about the management of the root displacement of the mandibular molars. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also click on the bell icon so you will get notified about our future videos and updates. Thank you.